Kia ora, everybody. Welcome to the ACE RMO 2024 Northland webinar. My name is Georgina. I'm the ACE RMO consultant. We're going to start off with the opening karakia, and then I'll give everyone a brief outline of today's webinar. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina kina ki uta, kia mā taratara ki tai, e hi a ke ana, te atakura, he tio, he huka, he hauhu, tihei moriora. So thanks to everyone for taking the time to join today's webinar. We'll move on to the panelist introductions very shortly. During this webinar, we will have a video to share with you all, and then that's followed by a presentation presented by our panelists. And then our RMO representatives will tell you a bit more about the experiences working as a PGY1 in the region. Towards the end of the webinar, we will have a live Q&A session, and then we'll finally close off with a closing karakia. Just a reminder, all questions can be dropped in the Q&A box below your screen. Hopefully you can see that, but these will only be answered during the end of the session.
Kia ora, my name is Luke and I work with the RMO unit up here in Whakarai.
Kia ora, I'm Adam Nolan, I'm a nephrologist and I'm the Director of Clinical Training.
Kia ora, my name's Evangeline and I'm a PGY1.
Kia ora, I'm Steph, I'm a PGY2.
Kia ora, I'm Lisa, I'm the Chief Beverage.
Kia ora, I'm Amanda, I'm the Service Manager for the RMO unit.
Kia ora, ko te Atiawa Tiwi, ko Jess Radovanovich tōku ingoa. I'm Jess Radovanovich. My father's family is from Taranaki, my mother's family is from Waipu here in Northland, and I grew up in Northland. I first started working for what was then Northland DHB in 2004 as a physiotherapist, and went away and did medicine after some years and back again now as a PGY1. I started on general surgery as my first run of PGY1, and even though I was familiar with the hospital, it was still pretty daunting prospect, really steep learning curve, but the team here has been really supportive. We have a pretty flat hierarchy here. Everybody's really approachable and the team environment just works in a way that I haven't experienced anywhere else. And the highlights of the general surgery run, I guess, are getting to do the real work of medicine. It was my first run. I really liked the opportunities to go to the suturing clinic, to go to theatre. I held cameras a number of times and assisted with operations, which I think is pretty rare as a health officer in some of the big hospitals. And the increasing complexity of our patients blows my mind a bit, but makes every day really interesting and different. I have a great cohort of PGY1s, 2s and 3s. It's really great having such a diverse cohort. We've got people here from all parts of the world, and I've really enjoyed getting to know them as friends as well as colleagues.
Kia ora mai tātou, ko Francis Bradley tōku ingoa. I tupa mai whānau mai I Kaitaia, engari no tā wāhi o ku whānau, no Āwherika ki te tonga, no Kotarani Airani Motua tāne. Tū ana hei mataora I te hohipere o te whanga reipai, arā ko whangārau. I tēnei tau, ko ngā huringa ki te hohipere, ko te tari hauora me te tari poka. Sino pai kia hau wenei o ngā huringa o ko te hohipere katoa, nā te mea ngākau mahana ngā tangata, hei whakaako, hei awhiawhi, hei tautoko I te haerenga kia tū hei tākuta, kia mahi āringa, kia whakaaro me pēhea tātou te tiaki I ngā whānau I ngā whaiora. Nō reira mena hia koe ki te taumai ki konei, ka tautoko ngā tākuta katoa, ngā nehi, te mea I a koutou.
Kia ora, my name's Ruben and I'm a medical registrar at Whangarei Base Hospital. I did my university training at Auckland Uni and subsequently did my final medical student year at Whangarei as a trainee intern. I've done PGY1 to 4 up here, so I've done medical and surgical runs. The runs that have probably stood out to me have been my placement in the renal department here, and also I was lucky enough to spend 3 months up in Kaitaia. So I've worked in the medical department for the last year here. It's a really cool department to work in. Everyone is incredibly helpful and supportive in and outside of hours. It's a really easy place to settle in.
Hello, my name is Bianca Roslow. I'm one of the medical registrars. I did my training in Scotland in a variety of rural hospitals, and I decided to come to New Zealand after FY2. So I thought Whangarei was the perfect place because of the rural setting. I'm really interested in rural medicine. Northland also has a lot of beautiful beaches and a lot of things to do. I started here in geriatrics and I'm now working in acute medicine. It's really well supported by both the other registrars and the medical consultants. Every day is really varied. We see a lot of high acuity patients, and I think as a junior doctor it's a really good place to come and learn and see pathology that we just wouldn't see back in the UK.
Tēnā koutou, Bulavanaka, Talofa, kia rana ko Daniel Whiwhita tōku ingoa. He urio no ngā puhi me tonga. He tākata tau tuarua ahau ki Whangarei Hospital. So I trained in Auckland University and did my last year as a TI up here in Whangarei Hospital, and then stayed on to finish my house officer years. I'm currently PGY2. So I guess why I chose to work in Northland, the first thing that comes to my mind is he aha te mea nui o te ao. He tangata, he tangata, he tangata. So what is the most important thing in the world? It is the people, it is people, it is people. Honestly, the people here are amazing, not only the colleagues, but also our lovely community. You feel constantly at home when you talk to kuia and kaumātua. You're constantly laughing with the aunties, cousins, and you're admired by the potential in our rangatahi, and you are inspired by our beautiful piepi. We have a really supportive working community that's not only the doctors that you work with, but also the different staff that you're involved with, the nurses, the ward clerks, the cleaners, the HCAs. Everyone is really involved in the patient's care and also involved in your own well-being, and they really care about you.
The people that I get to work with every day make the job. I love the friendliness of the hospital. You feel like you're part of one big team.
And I'd definitely consider coming back here long term.
One of the main things that sticks out about this hospital is how friendly everyone is.
Mena, kei te hia koutou, ki te ako, ki te mahi, ki te tuku I te aroha, tēnā mauria mai tō mana tō tapu, tō whakapapa kia tiaki mai, kia manaki mai ngā whaiora whānau me te hapori o te tai tokerau. He tino a tāhua tēnei rohe, he taonga I ara ki te taimai ki te mahi, honotahi ki ngā kaimahi me ngā whaiora. Nō reira, tēnā, hara mai.
Wow, that was a really amazing video.
Kia ora everybody. I'll just be running you through a quick presentation about Whangarei Hospital and what we have here in terms of services and what your PGY1 year will look like in PGY2. Okay, so this is just a little bit about Whangarei and the region in general. So as you can see on the slide there, we cover a fairly large area. So all the way to the top at Cape Reinga and just down to south to Te Ana. We have 4 hospitals in this area with a number of beds. Whangarei is obviously the largest, it's the base hospital. It's 309 beds here currently. Then you've got Kaitaia with 31. There's a couple of theatres up in that hospital as well. Then you've got Rawani and the Hokianga, and Dargaville with 24, and Bay of Islands and Kawakawa. They provide a community-based outpatient and mental services to all of those areas as well. It's a very rural area once you get off State Highway 1, so it's quite hard to provide services to those rural communities. Something we try to do every day. We are looking at having a new hospital built, which is starting in 2026. So that's something to look forward to up here. So this is just a breakdown of the population in Te Tai Tokerau. It was 201,000 in 2021-22 of the last census. However, that's probably a little bit larger now due to the influx of population. Whangarei district obviously has the largest at 101, followed by the far north and Kaipara after that. The population tends to be a little bit older up here in the north, with people retiring up into the Bay of Islands and all those lovely coastal areas that we have up here. We also tend to have a higher population of Māori and a lower Pacifica population. As I said before on the previous slide, it is quite a rural regions and lots of higher rates of deprivation amongst the community. So we have some of the highest rates of coronary artery disease, diabetes, lung cancer, chronic respiratory disease, stroke, and asthma in the country. So why would you choose Northland or Te Tai Tokerau to come up to? Plenty of lovely spots to go and do all your hobbies. Bay of Islands is just a hop, skip and jump away from Whangarei. It's about a 45-minute drive. A little bit further to go to the top of the North Island, but a magical spot if you want to go up there. Plenty of untouched beaches that a lot of New Zealand don't know about, so more than likely you'll be the only one on the beach in most of these places. Plenty of perfect dive spots, great surf spots, and plenty of walking to do if you're into that sort of stuff as well. So if you'd like to choose us as your first step in your medical career, it's a great place to get hands-on teaching. Obviously, we have a variety of services available for you to do this. You can make it your home for 2 or more years. You can do a lot of your training here prior to moving into your vocational pathway. You'll work side by side with a lot of the consultants, and we have an environment that helps support your learning. What other benefits we have an RMO lounge for you on site, clinical library on site, a brand new refurb gym 24/7. We have a seasonal outdoor swimming pool as well that's opens after Labor Day, closes around about Easter, and that's manned on the weekends by a lifeguard if you want to bring your family along for some swimming. There's on-site cafeterias. You get very professional experience and sociable working conditions. In Northland, you'll get good pre-vocational educational supervision. So there's a very close-knit clinical community up here. There's less formality when it comes to having access to the senior medical staff. There's a diverse range of demographics of a higher proportion of Māori than most other regions, a large geographical spread, and some small rural communities that require our services. The CMO and the ACMO will be available for feedback during your protected teachings on a quarterly basis. There is a pilot program in place for developing individual cultural competency plans based on the Takarangi Cultural Competency Framework. And we have launched in the last couple of years a careers event that's attended by senior medical officers to help promote vocational pathways to junior doctors and give them an idea of what training requirements they have and why it's a great career path to go down. You will be attached to your PES for the entire PGY 1 and 2 years, and they're there to support you from your transition from a junior doc to a junior doctor, provide you with any information around your educational supervision, pastoral care, any career planning requirements that you might have or advice that they can give you, and you have one-on-one quarterly meetings plus more if needed by them. On this slide here, we just have a list of the runs available for our PGY 1 runs. You've obviously got Gen Med, Gen Surge. Also amongst that, you've got renal assessment unit, health of older people, stroke, rehab, urology, and orthopedics. When it comes time to make the calls for your PGY 2 runs, you'll be looking at community-based attachments, which are currently in Kaitaia. We have a couple of GP ones and a very popular hospice attachment at the moment. You also get the choice to work in medical admitting, ENT, ED, pediatrics, O&G, acute care of the elderly, psychiatry, and ophthalmology. We have regular house officer teaching, which is protected on Tuesdays and Thursdays between 12:30 and 1:30. There's a journal club, and we regularly hold grand rounds on a Wednesday that you're more than welcome to attend if you can make them. Otherwise, they're recorded and published throughout the wider community. So a typical PGY 1 roster, you will be expected to work a long day, which is up to 4 per quarter. On the weekend, you'll do 2 sets of weekends every quarter, and that's generally 2 short days and 2 long days. a swing shift, which is approximately 2 sets per quarter, and that's a shift that runs between 2:30 and 10:30 of the evening. And you will not be doing night shifts for your first 6 months of work. Here in Te Tai Tokerau, we are committed to supporting training for courses and vocational pathways. These are the current list of the ones that we have available. So anesthesia, ENT, general surgery, intensive care, pediatrics, renal, rural hospital medicine, emergency medicine, general medicine, geriatrics, orthopedics, psychiatry, urology, O&G. They're all accredited runs with the MCMZ. We provide excellent hands-on and well-supervised training in all of those areas. We have close links with Auckland as well to provide tertiary care, and many subspecialists do outreach clinics in whangarei from Auckland. There are positions available for basic and advanced trainees with college accredited registered trained jobs in most specialties. Selection criteria for this year's PGY or next year's PGY1s. We're most interested in hearing from you in regards to why you're choosing to come to work in Northland, what benefits you see as training away from a larger training centre such as Auckland or Wellington or Canterbury, what changes to the health system can most reduce the health inequities suffered by Māori, and how you can contribute to Northland, Te Tai Tokerau in general. If you would like a questionnaire, we can send this out to you. Just contact the RMO unit at the listed address, and we'll send that out to you to complete to attach to your ACE application. So as you all know, the application's now open. They close July 5th. We will get the notification from ACE and selection panels will be put together and offers will be sent out on the 2nd of September with acceptances by the 9th. Thanks for listening to the presentation.
Thank you so much. We'll now hand over to our RMO reps to tell us a little bit more about what it's like and sharing any tips for working at Northland.
Okay, I'll start. My name's Lisa and I'm the Chief Med Reg. I have been at whangarei now for 4 years. I came because they offered me a job, but I stay because the place is an amazing place to work. It's a really well supported environment. I think unlike a lot of other centres, I've worked in a lot of centres in the UK, you don't have that accessibility to consultants that we get here. We have in medicine, especially because I'm working medicine, we have a daily handover where all the medical teams meet together. So it's a very collegial place to work. We also have a lot of contact with our house officers because we work in teams, but also on call shifts. We see quite a lot of our house officers because we have formal handover periods. We also have what we call our ward phone, where any house officer can access a medical registrar any time of the day or night if they need help, which I think is different to a lot of places because it means that there's always someone senior to call, no matter what specialty you're in, because sometimes if you're a surgical house officer, your boss might actually be in theatre, so you can't get them straight away, but you can just call a more senior doctor to help. I think that makes us all work really well as one big team, because it doesn't matter whether you're in medicine or surgery, if you're a PGY1, PGY2, we get to know all of us together. You get to know your med regs, you get to know your surgical regs. I think it makes for one really nice working place.
Yeah. Kia ora, I'm Steph. I'm currently the ophthalmology house officer. I'm PGY2. I started here last year, having done my 5th year in whangarei, and decided to come back for many of the similar reasons. I just loved that it was a slightly smaller hospital where the hierarchy kind of is not non-existent, but very much non-existent. So you get to know everyone. There's no question is like, you can ask anyone anything basically, and everyone will help you with a smile 99% of the time. It feels really well supported. And like, you know, your first year is always going to be tricky, but there's always someone to call or someone to ask up here. You get quite a good feel of a lot of different departments up here. So even though it's small, you do get a good exposure to a lot of things. I mean, I'm doing ophthalmology, which is one of the weirder things out there. Yeah, so I've quite enjoyed it, and I think there's always people around who have got your back.
So kia ora, yeah, Evangeline, PGY1. So I'm on my 2nd run, so I've been here for about 4 months, I think, working. I decided I wanted to come here after doing my 5th year here as a student in the Pukaukaua program. So I was always sort of planning for that, and basically for many of the same reasons. Like, it's a really great place for starting your house officering years, which is always daunting, but really helps having a med-reg on the phone and nice people you can talk to. Another thing that hasn't been talked about that was really big for me was like the focus of the region on Haura Māori or Māori health and on equity. So that's like something that if you know Northland or come to Northland is a really big focus of the area, which if you're interested in helping mitigate that in your work or caring for those communities, then it's a really awesome place with lots of people who are passionate in that. And yeah, if you don't know what exactly you want to do, it's really cool in terms of getting to see a specific specialty and having exposure to it and getting to know just bosses and more senior colleagues on a better level than maybe a bigger centre.
Perfect. Thank you so much. Okay, we'll just move on to the questions now. This person has asked a couple of questions, but I'll just read them one by one. Is there any preference shown to one university over the other?
No, not at all.
It's good to get a spread as well, you know.
Yeah, yeah. It's not. We don't look at that in the selection panel at all. It's not a factor.
Perfect, thank you. Next question. How easy or hard is it to get accommodation in Whangarei?
I think once you know where to look, it's not that bad. So I think if you know that you're coming up here to get part of like the Whangarei Massive chat or talk to some people who are already up here, and it's a lot easier to sort of get your ins about and know who's already got places and who's giving up their lease. So it's just about once you know that you're coming up here, getting in contact with people if you can't find something just on.
Yeah, people do help out one another. So I think trade me and things are relatively scarce, like lots of areas, but like myself and some other PGY ones are living in a previous surgical registrar's house because yeah, there's those chats and everyone, even if you're not at the same hospital at the same time, generally help one another out.
Great, thank you. How much opportunity is there for research/audits?
There is opportunity for research and audits. There actually is a research day that coming up this Monday, which you can go to, and there's like research experts that anybody can talk to. There's quite a lot of surgical research projects going on that they have just sent out a mass email saying anyone who's interested, and it wasn't just house officers, it's also registrars, and there's some students who are based in Whangarei as well, and basically anybody could say they were interested, and then they've sent a whole host of topics, and that's just research that I'm sure there is for lots of departments.
I think it's about expressing an interest as well. I think if you talk to a lot of the bosses, I know for ophthalmology, I expressed an interest and we're getting that underway. So I think it's just about letting people know that you're interested.
And actually, as you develop, there's actually a medical registrar position about quality improvement and research. So you do half-time medical research quality improvement, half-time acute. So that's actually a thing that we're developing even in training at senior levels as well.
So yeah, there's a big push to increase research here. We've got the clinical trials unit running now, and I mean in nephrology we have multiple, I think 4 studies running in nephrology alone. So
excellent, thank you. What is the social life like within the hospital and Northland in general?
Pretty good. I mean, just as an example, like we always go out for brunch after night shifts as a fun little post-night shift activity.
There's social sports that are on different teams. I think when we started and moved up here as PGY 1s, the PGY 2s had like a barbecue at their house to get to know us, and I think pretty much as social as you want to be. There's opportunities.
Great. Next question. What factors do you look at when selecting PGY 1s?
The selection panel, we like to see that you've got an interest in Te Tai Tokorau as a region. We're really interested in PGY 1s. Doctors coming up here actually want to contribute to the region and envision themselves being here long term. Obviously up here, we've got the Royal Hospital Medicine program that runs, and one of their key focuses is to have the trainees go through there and come back as SMOs. And I think that's sort of what we envisage a PGY 1 wanting to do when they come to Northland, is they want to do their training years here and then come back as an SMO after training to give back to the community. I'm pretty sure you'd be along the same lines, Adam.
Absolutely, yeah. No, we really need to hear why you want to come here. I mean, you know, that it's very likely that lots of you are extremely qualified to come here, but we want to know exactly what it is that you want, why you want to come to Northland. That's the key thing.
Next question. I may have missed it. Are there interviews?
No, we are not holding interviews. As was seen in the presentation, if you missed the presentation, if you contact the RMO unit via the email address that's on that slideshow, we'll send you out a PGY1 questionnaire. Literally like an interview questions, and you get to fill it out yourself, put some thought into it and attach it to your application, and that puts your best foot forward. People can organise to come in and see us if you're available to come in and visit the hospital, or we will take you around for a tour around the campus and show you around and answer any further questions you might have. If we have a teaching on that day, we might see if you can attend your teachings and meet some of the current cohort. If you'd like that, again, just contact the RMO unit and we'll try and accommodate you as best we can.
That's great. So remember to get in touch with the RMO unit, guys. Next question. How expensive is the cost of living in Whangarei?
I lived in Auckland for like my 6 years, like my undergraduate and most of my training, before moving to Whangarei and then to Waikato for my last year. It's definitely cheaper than Auckland. It's not incredibly cheap, the rent. Like I lived in Waikato last year and that was quite cheap, the rent, but it's not Auckland prices. So I would say it's somewhere in between. Yeah. And then like there's a staff gym here, which will cut your costs if you want to go to that, which is pretty good. And there's generally lots of free activities, I would say, in Whangarei. Like there's lots of hikes and beaches and all outdoor things. So I think in general you're spending a lot less, or at least I am, on sort of social activities.
I spend way less in petrol as well up here going to work than in Auckland, because my commute is 10 minutes versus 40 minutes, which it was in Auckland. So
I walk to work, so
yeah, exactly.
That's great, thank you. How important is having a connection to Te Tai Tokerau?
I don't think it's incredibly important. I think the panel would like to see that you maybe have some connection, but as Adam said before, it's more about why you want to come and work here and your potential to give back to the community. That's what we want to see, rather than your direct connection to Te Tai Tokerau.
It's about understanding the different challenges that our region has compared to other places. I think coming from an outside place, I think it's probably a lot like some of the PGY ones. I obviously did not know, coming from England, a lot about the health disparities until I read about them. I think that's one of the things that is really important about our hospital in particular, is what we give to our community and what our community gives to us.
Cool, thank you. What support do you have for Te Ao Māori development? For example, Te Reo classes.
So there's Te Reo classes are running. They actually just stopped because the teacher got sick, but they're about to start. Well, they'll start again in mid-year, so that any staffing that could apply for and do. And there are two sort of different levels, like complete beginner and then slightly more advanced. And then we also have our taka wāinga in our hospital, which are our Māori liaison service. So they're around on all the wards, and they're a sort of intermediary between us and our patients, and they help not only our patients with their experience of being in the hospital, but they also help us with our experience of being in the hospital, and they're really good. I often have a quick chat in Te Reo Māori with them, or ask them about some specific tikanga, or just like have a little chat. So they're always around and happy to help. They've just helped me with an application to do a year Māori diploma, so they're always around for that sort of stuff. They help me with the little mahi, so we've got a lot. I think we've got quite a lot of support, really.
We also have a newly appointed role, Dylan's role, and he's a registrar taking on supervising Māori doctors. So he's a Māori doctor himself, supervising other Māori doctors and trying to support them through their unique challenges, which are different sometimes to Pākehā doctors, which I think is really nice as well. It's a new role rolling out, which has also been quite good.
Yeah, so he's made a group for all of us Māori doctors, and we've met up once now.
Cool, thank you. Next question. How's parking in general and around the hospital in specific?
Oh, so we do have parking. There is a hill of death, as I call it.
Yeah.
But that will be because I'm a 42-year-old woman, and the hill of death is the hill of death. But it's often I think parking isn't necessarily an issue. That the hill of death is an issue because you have to walk up it to come to work and down it on the way home, which is quite nice because you can just roll down it when you're done for the day, which is good. We also have designated RMO spots for if you're on long days or night shift. There's it sort of nods down the bottom of the hill, is close to the hospital, so it's very secure and safe. We have on-street parking as well if you get here early enough.
Yeah, we also hire one of the local rugby clubs car parking so that staff can park there as well, because obviously we're aware that car parking can be required. You know, it is quite tight around those daytime shifts, so we try to accommodate as much as possible.
It's a lot cheaper than Auckland parking too. I don't know what it actually is.
It's $1 a day.
It's $1 a day.
It's $1 a day, yeah.
Which is-
And generally you can park for free if you're here before 7:30. Or yeah, on long day you
On
can
the
park
road.
right there.
And you get your free exercise doing the hill.
Yes.
Yeah.
That sounds good. Thank you. What does the introductory week involve prior to starting PGY1?
The best part for me was the first day you all go to a marae and have a pōwhiri there, which is really nice because before you start any clinical work, you have a whole day just to meet the other house officers and some of the RMO unit and some of the team, and just get to whakawhanaungatanga and get to know each other. That was my highlight, was that day.
Yeah, that day's really cool. Then the rest of the week is you have a combination of things. You get talks from the PGY2s and they give presentations. You get a talk from the med-regs, you get a talk from pharmacy, you get specific details of like the hospital and the information. So it is that week I've obviously just recently done it and it was really good in terms of went through everything kind of that. So if you'd come from a different hospital and never come to Whangarei, they took you on a tour and people had come from fully electronic hospitals, and so that it was kind of like everything you need to know, and you do one day of like an ACLS. So it was a lot, but and you get to go on the wards actually for a day with a PGY2, which is really good because they can show you where everything is, and so then when you're starting on your own, yeah, it's quite good.
That's good, thank you. Is there much scope for PGY1s to be involved with the Auckland specialties who come up for the outreach clinic?
In ophthalmology, when we have Auckland consultants come up, like I get to sit with them, like the retinal specialists, because we don't have retinal specialists, or like some of the pediatric consultants, but I don't know about the other specialties.
Maybe a PGY2 or something.
Yeah.
Yeah, it's probably
PGY2.
It's would be mainly PG2. Yeah. I mean, I look at if there was a specific thing you were really interested in. I mean, we have the transplant team come up from Auckland, for example, and do transplant clinics in nephrology once a month. If that was an area that you were really interested in, we could try and see if you could sit in on the clinic. Yeah. So I mean, I think the main focus of your PG1 is to get those key skills in medicine and surgery, and that is what we are best placed to deliver to you.
Great, thank you. Our last question is there public transport around the hospital?
It exists, but not, I wouldn't use it. I don't think it's regular enough.
Yeah, the bus service is not great in Whangarei. It's reliable, but it runs on every 15-minute interval, so it's not like a bus every 10 minutes, and it depends which way it's going.
You can walk into the town centre. It's not.
You can walk into town.
Yeah.
It's more walkable than public transport.
Yeah.
And we have purple scooters.
Purple scooters.
Yeah. That's quite popular among some of the people that live sort of 20 or 30 minutes away. They will scoot into work.
That sounds good, thank you. I think that was the last of our questions. So if you have any further questions, please contact the RMO unit, or if it's regarding the ACE process, you're welcome to contact me. We will now close off with the closing karakia. Kia hora te marino, kia whakapapa pounamu te moana. Hei huarahi mā tātou I te rangi nei, aroha atu, aroha mai, tātou, ia tātou katoa, hui e tai kie. Thank you, everybody.